Hey people, look at this. I'm stunned. Not. Get your flu shot. Aussies told as coronavirus winter. We don't have a normal winter anymore. Okay, it can't be just winter's coming, get a flu shot. No. It's a coronavirus winter. It's different to last winter. It's different to the next winter. Okay, this is a coronavirus winter. Okay, but check this out. When I want to scroll down with my friggin' little wheel, it won't. Check this out. Flu shots this year are even more crucial due to the COVID-19 pandemic. Australians have been warned. Australia's Deputy Chief Medical Officer, Professor Michael Kidd, said flu season starts in the next month and now is the time to prepare. Vaccines are essentially important this year for people at increased risk of influenza, he said. So obviously there's a targeted people, okay? There's a targeted people. Not anybody can get the flu. I mean, shit, everybody gets the flu sometimes, okay? So really, at the end of the day, we're all targeted to get it at some point, okay? Flu vaccines are free oh wow, like we should be overjoyed for that, for vulnerable people, including older Australians, young children, those with chronic conditions, and Indigenous Australians. For those that don't know, let me tell you something about our Aboriginal people, okay? They live and lived off the land. They walked around barefoot. They walked around barefoot. They weren't diseased. How can they be vulnerable? How is it that now all of a sudden they're on the vulnerable list? But anyway, let's move on. Professor Kidd said there was a current total of 6,948 cases in Australia, with the death toll still at 97. 8 new cases have been recorded in the past 24 hours, yada, yada, yada. So far, 6,179 people have recovered. Oh, look, they recovered. From what? A flu? There are 49 people in hospital, with 16 in intensive care and 14 on ventilators. Well, that's a lot of money for those hospitals, right? Considering we all know they get what? 39,000 for each person that needs to use a ventilator? This is not a time to become complacent. There are very serious risks if overcrowding starts to occur. Overcrowding where? In the empty hospitals? COVID-19 is still out there in our country. Oh, it's looming. It's hiding behind the bushes. He urged people to maintain physical distancing, avoid crowds, wash their hands, and download the COVID Safe app. Let's throw that one in there. COVID-19 tracers, the disease detectives. The disease detectives. I just put up what they're doing with the mobile phone cameras and how they're busting people on the road in 1 month, 7 million plus fines, because their mobile phone detecting cameras are zooming into your vehicle. But hey, COVID-19 tracers, the disease detectives, would hopefully start using the gathered data in a couple of days. Well, hang on a minute. Weren't we supposed to go over a certain limit before it was actually enforced? Is there that many stupid ass fucking Australians that they've gone over that 40% mark of downloading the COVID-19 tracer, because he's clearly saying it here, would hopefully start using the gathered data in a couple of days? But anyway, what can one say to the useless eater? Comply. Just fucking comply. You know, you don't want to stand up. You don't want to do anything about it. You don't want to push back. You don't want to let go of your mobile phone. Fuck it. God forbid you let go of that bitch. God forbid you let go of it. God forbid you just leave it sitting at fucking home while you go out and do your shit. Oh no, because there's always going to be those weak, compliant people who either dob other people in, who would have downloaded this, yada yada. Their intent is to bust everybody for social distancing. This is all about making money for them off the useless eater. Wake the fuck up. Wake the fuck up.